Schizophrenia is a complex mental health disorder that affects around 3.5 million people in the United States. This severe condition disrupts how a person thinks, feels, and behaves, often leading to episodes of psychosis, including hallucinations and delusions. People with schizophrenia may experience distorted perceptions of reality, along with disorganized thinking, memory difficulties, and reduced motivation. It usually develops in late adolescence or early adulthood and can impact anyone, regardless of gender, race, or background. The exact causes of schizophrenia remain unclear, but experts believe a combination of genetic, environmental, and neurobiological factors is involved. A family history of schizophrenia increases the risk, while environmental factors like trauma, substance use, or prenatal stress can trigger its onset. Abnormalities in brain chemistry, particularly involving dopamine, also play a significant role in its development. Living with schizophrenia in America poses unique challenges. For many, the disorder leads to struggles in maintaining relationships, securing employment, or managing daily tasks. Many people with schizophrenia face social isolation, unemployment, or even homelessness. Antipsychotic medications are essential in managing symptoms by regulating brain chemicals, but these medications can have side effects such as drowsiness, weight gain, and other long-term health issues. Psychotherapy and community support, such as cognitive behavioral therapy, CBT, can also be effective but are not always accessible, especially for those without adequate health insurance. A significant barrier for people with schizophrenia is the stigma surrounding mental illness. The disorder is often misunderstood, leading to discrimination and fear. Many still falsely believe that people with schizophrenia are violent or dangerous, but in reality, they are more likely to be victims of violence. Media portrayals have often amplified this stigma, making it even harder for people to live openly with the disorder. In recent years, there has been an increasing push in the U.S. to reduce the stigma of mental health conditions and provide more comprehensive care. However, the American mental health system remains fragmented, often prioritizing short-term crisis care over long-term treatment. Hospitalization may be necessary during psychotic episodes, but follow-up care like therapy or housing assistance is often lacking. The high cost of treatment further complicates access, even for those with insurance. A particularly visible issue is the relationship between schizophrenia and homelessness. Studies suggest that up to 25% of homeless individuals have a serious mental illness, including schizophrenia. Without stable housing, maintaining a treatment plan becomes nearly impossible, worsening their condition. Some cities have begun to provide supportive housing, which combines shelter with mental health services, but these programs often lack the funding to serve everyone in need. Another major concern is the overrepresentation of individuals with schizophrenia in the criminal justice system. Jails and prisons have, in many cases, become de facto mental health institutions, as people with untreated schizophrenia often end up incarcerated for minor offenses. Once in jail, they rarely receive proper care, leading to a cycle of incarceration and worsening symptoms. Mental health courts, which aim to divert individuals into treatment programs rather than jail, have shown promise, but remain underutilized. Despite these challenges, there is hope. Ongoing research continues to uncover more about the biology of schizophrenia, paving the way for better treatments. Programs focusing on early intervention, catching the disorder in its early stages, are proving effective in reducing the long-term impact on individuals. Support groups and organizations like the National Alliance on Mental Illness, NAMI, provide critical resources for people living with schizophrenia, offering education, advocacy, and a sense of community.